There are so many questions to ask when it comes to dog and cat nutrition, and with social media on the boom, it's really difficult to get accurate and trustworthy information. So this entire series that I'm covering, I'm talking to specialists in their field. Go check out the previous video where I spoke to an actual qualified pet nutritionist. So today, we're going to talk to one of the veterinary nutritionists that is actually employed by one of the largest pet food companies in the world, ask all the appropriate questions. This entire series is not about me throwing my opinion onto you or trying to brainwash anyone. It is simply to state facts and for you to make informed decisions when it comes to your pet's nutrition. Check it out. Good, thank you. Do you maybe want to just introduce yourself to the viewers and tell us more about who you are and where you work and such?
So I am Dr. Megan Brown. I qualified from OP in 2013, so makes me ancient, I suppose. And from there, I went into private practice and spent 9 years in private practice. Over 2016 and 2017, I completed an honors degree specializing in internal medicine and anesthesiology, which are two passions of mine. And then what I did when the pandemic hit, I was actually going to have a little boy. So our little boy was born in 2020. And so I took some time off that year and then went back into locomine. And at the beginning of 2023, yes, I think that was like 18 months ago, I joined Hills as a professional consulting veterinarian. So what that means is I'm basically in charge of all the technical training that we give. It's like vet help, vet support, I suppose, just like really there for the industry and helping them to vets like learn about nutrition, where it fits in, and basically how we can use it to our advantage.
Okay, thanks so much. You see, I think the purpose of this whole video is that there's so much false information out there, and it's so easy to spread false information on social media, and easy to hear information from a friend, from a family member, from this person on social media. So the intent of this is to actually hear information directly from the horse's mouth about various topics, specifically nutrition, because I think that is probably the most controversial platform at the moment when it comes to the pet industry, isn't it?
Yeah, most definitely. I think what we're doing is we see often a lot of trends that come out, or like movements, as we talk about it. And a lot of these aren't necessarily based on any scientific evidence or any research that's gone into it. So I think it can be, and unfortunately, a lot of these can actually be dangerous to our pets if we're feeding them and not doing them correctly. So yeah, I'm really happy to join and like hopefully bust some of the myths.
That's awesome. Okay, I think let's start simple with an entry question that there's a lot of controversy around as well, and that is, in your opinion, are modern dogs carnivores or omnivores, and why?
Okay, so this is a very interesting question, and I think that the traditional view in most people is that they're carnivores, they're strict carnivores, but they're not. Okay, so they are classified as carnivoridae, so they fall into that like group. I think excuse my zoology, I can't remember which is a group or a family, but they're carnivoridae. But so a lot of people then just assume that means carnivore. But to put that in perspective, pandas also belong to carnivoridae. So that, and like pandas are strictly eat bamboo. They don't even touch meat. So it's not, that doesn't mean that they are carnivorous or meat eating per se. So what we see actually in how it's developed in domestication is that there are 36 gene variations, okay, between a wolf, because that's obviously where we're coming from. That's what we expect as a wolf, and the domestic dog. And so we see these 36 gene variations predominantly in digestion. Okay, so that's when we see it. And then in neuron transmission. So that's obviously in brain development we see. And then in like the other one we see is obviously in enzymes that we're producing. So in certain enzymes that we see. And how we see this is we now see them producing enzymes that make them more adapted, particularly to digesting carbohydrates, because that's, I think, the controversial topic there is, are the carbohydrates or is it just meat? So we see, we obviously see them, they have salivary amylase that we know that they can do. There's high levels of ones that help them digest. So it's called maltase, that's serum maltase. And then we also see them, there's difference in their gastrointestinal lumen that helps them like actually with glucose metabolism, moving it in and out. So very different. On top of that, we can also look at their dentition. So that's another indication that makes them more an omnivore than a carnivore, especially if you look at their back molars. Those back molars are more for a chewing type situation, rather than if we compare them to a cat, for instance, where we've got those very sharp molars that we see at the back. So cats, for instance, are carnivores. Okay, so that we can classify as carnivores. But in saying that, cats are able to use carbohydrates, and it does become like a critical piece in nutrition, is that because it does help in terms of boosting their calorie intake or their energy that they can take. So carbohydrates really actually are a good source of nutrition because they contain certain amino acids and certain other nutrients that we see that we don't necessarily get from a protein source. So for us, carbohydrates play a critical role both in like dogs and in cats. Obviously in cats, we have to be a little bit more critical in what we're seeing from them and what we're putting into them. But it's very important that there are carbs in there, because it does, as I said, especially when you're thinking lactating queens, they need an extra energy source. So important to use it, but it depends obviously on quality of carbohydrate that we put in there.
Yeah. I love everything that you said. You actually covered so many points that I wanted to bring up, and you just perfectly covered it as well. But the one thing I also mentioned actually in a recent post of mine is I told, because on this exact note of carbohydrates, um, is where I read a few, like I think I read 3 studies in total where they were actually measuring the pros and cons with carbohydrates in domestic canines. So this is not applicable to felines, where they actually said, well, the conclusion for all 3 of the studies were that there were no adverse signs associated with adequate, not excessive, adequate carbohydrate intake. Meaning, I think at Lucy turns to like, there's no downside to feeding an adequate amount of carbohydrates. Yeah, if you feed a 90% carbohydrate diet, sure, that's way excessive, even for a human, So a lot of these people that that kind of use the argument of not feeding carbohydrates because it's not part of their quote unquote natural diet. The big question I now start asking people is, so what is the bad? Why shouldn't I feed carbohydrates? It's a really good source of glucose, like you said, amino acids. And then the answer is normally, well, and then the conversation kind of fades away. Not to take the importance of fats and proteins away. That was just like I like when people make rationale. It's nice to hear the logic behind it as well. You have to argue for a conclusion, right? You can't just make the conclusion. You have to argue for it. Yeah.
So, and I think that's it's like everything has to be balanced, and I think that's the thing. So like balancing carbohydrates in a balanced way is what makes it critical. Obviously, if you're going to, as you said, if you put 90% carbohydrates in, they energy dense. We know they're energy dense, but that's what makes them so good in certain instances. But obviously, excess of that is going to have issues. The same as if we have excess protein. If we put too much protein in a diet, we end up with excess like protein residue that can be converted into uremic toxins that play a role in like kidney disease. So it's all about like balancing it. And as I said, for instance, we can even see, and I think the perfect example is taking a feline, for instance, which we know is a carnivore, but they can also use carbohydrates. So I think it's that misconception that carnivores only eat meat. So no, they need predominantly, carnivores as in cats need predominantly their energy source to come from protein, but they still need all those other components to have a balanced diet.
And while we're talking about these components that they need, what are certain ingredients or aspects that we should avoid when it comes to diets for a cat and dog? Talking about things like you said, excessive fats and proteins, but maybe undigestible fibers. Is that something that people should be leaning into, thinking about? Is that not a concern?
So this is a heavy, like, handed question. So if I can say that. So I would never say there's anything that should not be included, that we can just outright say no. Because, for instance, oh, okay, I'll make a correction. Unless there's some sort of contamination in it. So unless there's going
Yes,
to be
of
some like
course.
aflatoxin or something, then
In a
then
controlled
but yeah,
environment.
yes, but every ingredient and it like contains a certain nutrient, because I think that's also important to remember that ingredients, what we want from ingredients are nutrients, because nutrients are what feed the body and feed the animal. Okay, so by looking at that, we have to see what are we trying to meet, like what kind of condition, and it's so varied in so many ways. So first of all, like from we think about kittens to then adults to then seniors. And I mean, those are just the three simple aging processes, and their nutritional needs differ completely between those ones. But then you start, for instance, adding in any sort of like disease condition. So for instance, if we're thinking in terms of joint disease, we know we need high levels of omega-3 fatty acids. So that's going to be naturally a higher fat diet. Whereas what we want to do is, if we compare that to a diet for a patient with pancreatitis, we know we need very little fat in it. So that's got to have a low fat diet. So it's very difficult to say this we avoid and that we avoid. We've got to look at each patient almost in an individual aspect and to decide what is the best nutritional recommendation for that patient. And I think at Hills, why we play into that is because there's like, we go with science. Everything's based on science. So first of all, we look at, okay, what would the nutritional recommendations be for a patient with this disease? And then, okay, we've got those nutrition. How can we get the ingredients that meet that? Okay, and then we've come up with a recipe, and that recipe then obviously has to, because that's also another part in this manufacturing process. It's not just, you can't just throw ingredients together and like come up with like something that that they'll eat. It's also got to be, palatability is a big issue, how these nutrients are then absorbed, how they are, the digestibility of it. So it, like, those three components of nutrients, ingredients, recipes kind of play a critical role in how that diet is formed and what you get out from it. So there's never something that we can say no, it should not be like included at all. And on your point of talking about fiber, for instance, fiber actually is a very critical component to diets. And we can sort of simply divide fiber into soluble and insoluble fiber. Okay. We need both. Mammals need both, if I can say that. All right. But we don't, as a mammal, you don't use it at all. Okay, so we have no enzymes that can digest fiber. So we rely heavily on our microbiome, which is a species of bacteria that live in our gut. And what that does is they are able to ferment fibers. So we need fiber for our microbiome. And if we don't have a healthy microbiome, we can't necessarily, we know it integrates so heavily with everything else in terms of energy levels, immune systems. So we need to be able to include fiber. Fiber is a critical part, not necessarily for the mammal itself, but before the microbiome, which plays a much bigger role over that.
Yeah, and I think there's that general consensus thing of, approximately 70% of your immunity lies in your gut. So by supporting the gut, you support the patient or the animal, isn't that right? Right. But on the topic now, talking about kibble, when we're comparing, for the audience's sake, a premium brand such as Hills to other brands, even if they're on the premium range, other brands, what do you think would set Hills apart from your general other brands, for both the good and the bad? What is a trend that might not be done by Hills? For example, I think it's called carb splitting. Happens in some brands, which we'll have a whole talk about. Is that something that people need to be cautious of? What does Hills give the consumer? If you get the question, does it give them trust? Trust, you know?
So we, as I said in the beginning, our whole philosophy is based on science. Okay, so there's got to be a reason why we're doing this, and it comes from a huge amount of research. So for instance, we don't just pop up a diet. That diet's been in the making for like 15 years, for instance, because of all the research that's gone in there. So in terms of, if we look at Kibble, what we know, first of all, is that one kibble doesn't fit all. Okay, so that's like there's not one size fits all. And so if you open a couple of Hills bags, you'll see all the kibbles like look slightly different, or they've got different shapes and things like that. And it comes from the basis of, we know that like that plays a big role in like perception and palatability. So for instance, we know that the shape of a kibble is really, so what it looks like is really important to a cat. Okay, so cats are wanting a flat disc, for instance. They don't like something with a hole in it. That makes it less preferable. Texture, for instance, in dogs plays quite a big role. So dogs want a crunchy kibble. They want to be able to like crunch it, and size matters to dogs. So that's also like something that we take into account, is the size of the kibble, how it crunches in their mouth, like what the shape is. So it's a whole experience that they're going to be tasting. So it's not just about a flavor in that too. So, and that's why we obviously, and it's like science-based. And then we also then look at how we do a lot of like testing on these kibbles, first of all. So also like the pressure that goes behind in breaking this kibble. How much pressure do we need to break a kibble? Because that changes. And I mean, if you look at like a kitten compared to an adult, compared to a senior pet, those are all different. So they're like if I can call it like the breakage point of like the kibble is different in those depending on their strength. So a lot goes into not only just the nutrient component of what's going into our kibble, but actually like the design and how this kibble like plays a role in the eating experience of the pet is really important. So I think that like that is one of the things that like stands us apart. And as I said, it comes from years of science research that we've done. And then what also happens is we have in Kansas, that's where the Hills head office is, there's something called the Hills Pet Nutrition Center. And what it does is it has like the dogs, like if I had to be a dog in my next life, like that's where I want to go go and live, because they literally just living their best lives. All they are there to do is kind of test diets. Okay, so no research is done on them, if I can say. Like we don't do any research other than we're feeding them this diet and we're seeing what the results are from them. So they are taste testing, and I mean they get to taste test, they get to compare. So we have like real life experience of what these dogs are experiencing and what they prefer. The same with the cats. So that's where I think it, like we can send them, is like our kibble, we know that pets are going to be it's what they want, it's their preferred preference, and obviously it's going to be good for them because we've got completely balanced nutrition in every single kibble that we feed.
Yeah, that's amazing. I wish I could be one of those dogs, like living my best life in Kansas. One thing that I want to plug this in here, what you said in the previous videos as was, there's a big thing like that you can see on social media where people say the only reason that vets would recommend brands like Hills is because we're brainwashed and indoctrinated from the get-go, from being a student all the way up, and that we're only in it for the money and things like that. But then I make the counter argument to these people to say the following. Hills is science-based. If you're a vet, you are a scientist. You can't base your judgment on anything else because you have chosen to become a scientist, a veterinarian, right? So when you make recommendations to people, they need to be safe recommendations. The odds of things going the way as planned is much higher than that of it not. And Hills supports that. So if I advise a pet to eat this diet, the likelihood of the outcome being favorable to us is much greater than it being not. Now, I'm not saying for other things, for other brands, it's not like that. I'm asking, where's the data? There's nothing withholding any other brand to do data. And Hills has done, probably the most amount of studies and put the most amount of research into their diet, and that's why vets recommend it, because they're amazing at what they do. They've done the research, they've proven it, and I think you can correct on this, but Hills keeps up to date in terms of, they don't quote a study that they did in 1998 when they just launched. No, there was a study maybe done recently, or on a more frequent bag, or things like that. So I think that also counts a lot to why vets really push Hills, because they're science-based and they're safe bets. But now, moving away from kibble, I'm going to ask you some controversial questions, and it's only your honest opinion, but how do you think kibble diets as yields stack up to what's claimed to be the superior raw meat-based diet, in that spectrum?
Yeah, we like really, we really delving into it now. So I always like to stay, like I'm one that's obviously, as you said, like I trained as a vet and I'm a scientist. So I want to look at studies and I want to see, is there benefit and anything. So a lot of my opinion now that I'm going to come straight out of the WASAVA guidelines. So that's the World Veterinary Association guidelines, what they recommend in terms of raw feeding. There's obviously, as I can say, like if we start as where does this raw feeding kind of come from? Like where is it? There's like one, we can pinpoint it almost down to where we see it, like, so there's always been raw feeders and they've always done that, but then where there's been this massive increase in this like uptake in this movement, for instance, is there was a book published by a guy named, okay, Give Your Dog a Bone, by Dr. Ian Bellinghurst. Okay, and he kind of wrote his own opinions in this book, and it then like took the world by storm and went off. But it's not a scientific book. It's a book on opinion, but they've kind of taken this and then run with it. So the problem comes in when we're looking at raw diets is that there is very little science research done in terms of raw diet, and or if I can correct that, saying the benefits of a raw diet.
Yeah.
Okay. So there's a lot of opinion pieces. There's a lot of articles that you'll like find out there. They're not peer reviewed. They're not published in like the scientific journals. So it's a lot of more, as I said, opinion pieces that you see. So it appears that there's all this like research that comes behind it, but it's not actually, if you delve like deeper into it. So the problem comes in then is like, they are, well, not the problem, I suppose it's a really good thing, is that there are plenty of studies that demonstrate, and peer-reviewed studies demonstrating the disadvantages of a raw-based diet. Okay, so, and if we start like delving into what would those disadvantages be, I think the first number one thing that we can like probably come up with is bacterial contamination. Okay, so this is the fact that we run the risk of Salmonella, E. coli, Listeria are all present in these diets. Okay, there's a scary stat that I only just discovered, that 20 to 30% of chicken carcasses graded for human consumption, so ones we would go and buy in the shop, have salmonella or contaminated with salmonella. But why don't we get sick? It's because we cook it. Okay, so I think that's that puts it in perspective, is that cooking process keeps it safe. So with these raw-based diets, we aren't cooking them. So what happens is there's three possibilities. So the one is that we obviously, the pet's immune system can kind of deal with it. So the stomach acids and things like they sort it out. The other option is that then the patient becomes ill. Okay, that's like obviously they ingesting salmonella, they potentially are risks of salmonella. And then the more scary one that happens is colonization. So these bacteria actually come and form part of, as we've mentioned before, that microbiome. So now we've got this microbiome kind of sitting there with these bad bacteria. And the problem here is that these dogs are potential shedders of this bacteria. So they, in their stool and their feces, they are going to be passing this bacteria on. And it's not necessarily they're going to be ill, but anyone who comes in contact with this will then potentially be ill. So in terms of a vet's perspective, it poses a big risk because you've got contamination in your hospital. You've got, when these patients come into hospital, you've potentially got healthy or ill pets, puppies, immune compromised pets that are now exposed to this and therefore can become sick. So it really does, that's a critical point that can be, that is, in terms of a vet point of view, we shouldn't be necessarily recommending raw-based diets. And then secondly, in terms of an owner's point of view, if you've got any immune-based or immune compromised patient that lives in your house, it's children or elderly people or people with any sort of immune diseases, any of those become more at risk of developing these diseases or picking up Salmonella E. coli from these pets. And because the pets form part of the household, they're going to be exposed to it. So bacterial contamination is a huge, huge concern when we talk raw foods. And then we often end up with the counter argument is, oh, well, we freeze it. So, like you often find raw food being frozen. And the point is freezing does not actually kill bacteria. There are like reports of like scientists bringing back 100,000-year-old bacteria that have been frozen. So, and if you think about it, how do you preserve certain things? You freeze them. Like that's how they keep certain bacterial species in labs in like a cryopreservation state. So freezing does not, unfortunately, it is not a kill step. We cannot use freezing as that. And then the other counter argument to that is grinding. Okay, so if you grind them down, potentially you've ground the bacteria away. In fact, that's probably the worst possible, because what you've done now is you've just contaminated a whole lot more with the bacteria. So that's obviously a big one that we took in terms of raw diet. And then we obviously have like varying degrees of that. So then we say, okay, well, can we cook this raw diet? And then we end up getting with like home cooked meals, which falls into a different category, but almost into the same. So the fact is, yes, we might be dealing with the bacterial contamination here. But what we don't deal with is terms of balancing a balanced diet. Okay, so that's where we also fall short, is we don't know how much we should be feeding, of what ingredient, or like how much of this or how much of that. And so we don't know if that is a balanced diet for our pets. There are cases where you can, for instance, get a nutritionist to formulate your diet. They then work out exactly and specifically make a recipe for your dog, if they able, or dog or cat, I suppose. And if they are able to do this, this would nutritionally meet the requirements. But the problem comes in is that how often do you go shopping for ingredients and that ingredient is not available, or that something else, so you then substitute it with something else, and then you kind of like forget that, like, oh, actually we needed to go back. And so we see this like progression, or this evolution of the recipe, that by the time they started to what they actually end up feeding 6 months down the line is something completely different. So then has become unbalanced. And it's also, and the fact is that it's a lot of work. It's a lot of work for these owners to put in. And so they aren't necessarily doing it correctly to balance the diet. Then also, another problem we often see, and is if we talk to like our dentist colleagues, dental disease in these raw home cooked diets far outweighs that we see in terms of our kibble diets. We see plaque accumulation on their teeth, and it's just, we often have it, they are more regular patients at dental clinics than if they weren't. And then a big one that obviously we as vets are well aware of, but maybe the public not necessarily, is any of these raw or home cooked diets have the possibility, if there's any sort of bone, which they do include in raw diets, there's often a lot of bone component, foreign bodies. So these bones that are getting like stuck, and then we have to like go in and take them out. So there's multiple aspects of why a raw diet is not necessarily the best way, is not the best way for us to go forward. And it's just, we as vets don't recommend it for these reasons above.
I've got so many arguments to and for everything you said. I like, especially like what you said, like the moment it comes to anything that you want to feed outside of a kibble diet, you have a list of boxes to tick. And if you can't tick all of these boxes, not maybe one, all of these boxes, are you really doing your animal justice by trying to do this? And these include big steps. Like you said, maybe you can as well, during your time in private practice, how many people have actually in their lifetime gone and see a board certified, qualified with a degree animal nutritionist to formulate a diet? The vast minority. In my experience with my clients, are people, they pull recipes from the internet, or literally people that say my dog is on chicken and pumpkin. That is the diet. And I'm like, what? Like that is, you know, um, and then like you said, yeah, I also only recently learned that there's an allowable amount of salmonella and E. coli for human grade food because it works under the assumption that it will be cooked. That is why they're allowed that. And yes, your dogs are tough, but some dogs aren't that tough. You get some dogs that lick the floor and have a bout of diarrhea, like so. Yeah, my biggest thing is I tell people, it's big things. It's big steps. Do you? Well, one thing I must say, I think the average client does not do appropriate hygiene when it comes to their, pet bowls and things like that. But if you want to follow those diets, you need to be even more strict. So if you're already not washing your dog's bowls on a kibble diet, sure as hell you're not gonna be disinfecting, not rinsing it under the basin, disinfecting your dog bowls when feeding a raw meat based diet. And I actually didn't know about the cryopreservation point that you put up, because I think logic wants to dictate, oh, if I go to minus 10 degrees in my chest freezer, everything will die. But it's such a good point. I mean, we're bringing up old viruses and bacteria from dinosaur times. Yeah. So my thing also is I always tell people, like, the moment a vet makes a recommendation, you are held accountable for that recommendation that you made. If I as a vet tell you raw meat diet is great and yes, please feed your dog bones, and I see you a week from now with a dog bone in your dog's throat, you are going to tell me this will be free of charge because you told me to feed that dog a bone. I think it's that old saying of everything you say must be justifiable in court. That's under what a vet should work, and I think that's where Heels comes in because they've done the thinking for you. You just need to recommend. Just say this. Brain dead, easy decision because everything has already been done for me. Versus raw meat based diet. Oh yeah, but this and yes, this and also, but do you? It's just too. It's too much for a 15-minute consult. And there's just too many boxes to tick. So we just saying, stay away, stay away.
In terms of like for us at Hills, like it's not just one or two people sitting down and like, oh, these are what the recommendations. I mean, we have, I think it's close on, it's probably more, but the last time was like 200 like veterinarians that are certified, we like that are at Hills. Mm-hmm. That's on top of all like our nutritionists, like the actual veterinary nutritionists formulating these diets. So it comes from a large team who obviously put everything together. And so we know that what's coming out is, first of all, completely like meets all nutritional needs, but then it's also safe and convenient. Yeah. In these days where like time is critical for everyone.
So if I have to ask this question, because I know it's going to come up in the comments, what is the what would you say is the reasoning or the argument against for people that might say, but contamination of food is not unique to raw meat based diets. There have been withdrawals for Heels specifically and other dog foods as well for contaminants. What's Heels' protocol for things like that?
So we always encourage anyone, like if there's a problem or if they think that they've experienced a problem in terms of with one of our diets, to like contact customer care immediately, and we can track it. So the thing being in our bags particularly is we can pinpoint, there's like the batch number that comes onto there, we can pinpoint exactly from which factory it was made on what day, like down to the hour. So we know exactly what batch of food that is. So we track very closely our batches. So it also means that and potentially, and like it would be the worst nightmare, but if there was a contaminant, it's going to be contained into a very small batch and it's going to be found very quickly. Also because of us being an international or global company, we chat globally and there's a global like source of information that's keeping track of this everywhere. So the minute any sort of something is alerted, the rest of the world is alerted and we're able to like have a look and see what's happening in terms of our batches. But that's the thing, is we can track it so closely that to as I said, to time stamped, we know exactly where that's coming from. And our batches, and it's one of the critical steps that we do in terms of quality control. So we have quality control basically at every step that we do. So the likelihood of something like that happening is very, very slim, just because we do all these batch controls. And even after manufacturing processes, I mean, we still follow the thing of how are they stored, how are they shipped, how are they and they have to, all of those transportation things have to meet such high standards to ensure that there isn't any sort of contamination there. So it's another part that, because we put in so many steps in place, it's very unlikely that should happen and that there should be a batch withdrawal. You'll also see sometimes that and vets and clients can often sometimes complain as if we have an out of stock, okay, which we can see. Some of the reasoning behind that is that we are so strict on what ingredients and our suppliers and where everything comes from to meet standard, that if we can't get that ingredient, or if that ingredient is not available, we are not going to substitute it. We are not going to lower our standards and produce a sub-quality food. We would rather just take a gap, and then when it's back in place, then we are able then to reproduce it, so that we continually meet these high standards.
Yeah, and I think that the pinnacle of that confidence in your food is the guarantee that comes alongside Hills food. That is the pinnacle of confidence in your product, is the moment you add on a money back guarantee or a refund. So this is how confident we are on the Hills food. If something is wrong or not up to your standard, then you obviously can't leave one little pellet at the bottom and say my dog didn't like the food. That's not fair. But I mean, there's an old adage of, isn't it, as well, leading on to my next point. At the end of the day, you also pay for quality, and I think Hills falls into that premium brand that obviously comes with a price tag as well, but as with any premium product in the world, what would you say is a good argument for people that do make up the thing and say, oh, Hills is so expensive? And if I may, before you answer, what I normally tell people is, I say, if we really break it down, depending on where you are in the world, obviously there's various factors, but if you're making the argument to say that if I feed my dog a home-cooked diet or a raw meat-based diet, and you are feeding quality ingredients that are sustainably sourced, as most of them do, and at the adequate, go and do that math. That will not be cheaper than buying a good quality Hills product, for example. So people think it's cheaper because why? It tends to be, oh, but I can get the meat for cheap at my butcher, but it's the cut-offs or the side pieces of meat, and I can whatever the arguments are. But what would you say is a good argument that Hills may make for people to justify Hills carrying a higher price tag?
First, we can go down in two directions here. First of all, is the first one is, yes, ingredients and the actual manufacturing of the product itself. So yes, as I mentioned, we have a very high standard of what ingredients we put into our food, and they are human grade. So we make sure that all our ingredients are human grade ingredients. So we know that we've got high quality, first of all, going in there. And then what another big that plays a role in it, for instance, is that we are trying to do this sustainably. So sustainability is a huge core I suppose what's the word I'm looking for, value for in Hills. So it's one thing that we want to make sure that we are doing correctly. So we, for instance, all of our plants are zero waste certified, which means that nothing goes to landfill. Okay, so nothing coming out of there is going into landfill. We have also got water purification systems. So we actually, water that's coming into those plants is coming out almost cleaner. It's also reasons why, for instance, we don't manufacture necessarily in South Africa. We manufacture in areas where water shortage is not an issue. Okay, so we are not putting any extra pressure on the environment in that way. So it just makes it so a lot more environmentally friendly for us to do it. Our saying is there's no planet B. And so we really are wanting to make sure that we leave the planet in a better way than when we started this process. So that also plays a big role in it. So if we think that in terms of manufacturing wise, that's what we are looking at, is potentially why we carry a a premium price to it. But we've also then got to go down the leg of that a lot of our food and what we're producing in our prescription diets, therapeutic. So what we are doing is we are helping to combat that disease condition. If you think about it in terms of kidney disease, we know that nutrition has to be our number one go-to when we treat kidney disease. It's the gold standard recommendation that we do. So that has to be top of our list in treatment protocol. The same comes in when we are talking joint conditions. JD and our mobility diets, for instance, are the only thing that are going to slow down the degradation of cartilage. So we are everything else in terms of our drugs and that are slowing down or like minimizing pain, but what we do is we actually reduce that cartilage, so lengthening the lifespan of it. So it's a perception of value. So do you want value to have a monetary association to it, or is value your pet's quality of life? And I think in that makes a huge difference, as if you're thinking that this nutrition is not just a bag of food that you feed them every day. This is adding quality and quantity in a lot of cases to your dog's life. So it's a very different way of looking at it. I think that we need to do it, and that a lot of these diets, especially when vets are recommending it, forms part of their treatment protocol. It's not just added extra here, feed your dog. It's actually, we're doing this because it is part of how we're going to get your dog better.
Yeah, and I love that point that you said now about value. That's actually a very, very, I'm going to remember that one. But I think, and as well, on the point of prescription diets, I think it would be, to choose the right word, I think it would be silly for anyone to argue that Heels is not the global leader for prescription diets. I mean, from vets and consumers alike, the prescription diets are there's arguably no competition. They are absolutely amazing. And I hope nutritionists out there that are giving nutritional advice would recommend as your primary food for an animal that has a specific condition that Heels caters for, to feed that diet, because they are just, nothing competes with that. And then secondary can be anything else. But then on this topic of talking about all these food topics, in your experience being there as a private practitioner now moved over to Heels, the big question where people ask, should people or clients take advice from vets when it comes to diets and nutrition? Because I think the biggest argument is people would say that vets do not simply spend enough time with nutrition during their education. Do you think that justifies not taking nutritional advice from a vet?
That would be a big insult to me personally, because I feel like I put a lot of work into trying to educate our vets in terms of nutrition. But it also comes down to, is it's not we as vets are naturally like critical thinkers, I think, and we want to explore what's going to be, we're puzzle solvers. And so we want to, give the best advice to our patients. And so we go in, and in private practice, we go in and, well, what would that be? And we know that it has to include nutrition. So potentially some of the vets out there don't know very specifics about it, but they know that it plays a role. So what they'll do is they'll go and ask, or they'll find out for themselves, or they do that sort of research. So they are not underprepared to give nutritional advice, not at all. And if you're not going to take it, they are probably in the best position to be giving that advice. Like, who else would you be taking advice from? You're not going to, for instance, go to your hairdresser and ask them about,
You'd be surprised.
Yes, exactly. But I mean, it falls into the same category. The same as in terms of, we've also got to remember that we do, as vets, we do encompass everything. We are one of those that has to take into the whole holistic process. And I think people kind of misjudge that, because potentially in the human world, it's become quite specialized, and we see them like that, where we don't have that necessarily in veterinary medicine. So we are that, and we are trained to do it. So most definitely we need to be listening to our vets when they are making a nutritional recommendation for us, because that is the source of information that we need to take it from.
my interpretation of it as well is that I probably should be honest and say I think there are vets that I've at least worked with that maybe overestimated on how well they are educated on nutrition, but maybe because it's a very alpha mentality to be a vet that they wouldn't acknowledge when they've kind of hit their ceiling. They are there, but most vets that I've worked with have acknowledged their limitations with nutrition. Like as you said, you kind of know something, but maybe don't know everything. But where I make the counter argument to say that part of our development in the veterinary field is that you are able to access a lot of information very rapidly and make accurate assumptions very quickly. In terms of if you ask me a nutritional question, within minutes I can go onto the internet, source what is trustworthy information and make an assumption way quicker than I guess a regular layman would be able to do. Not saying it's unique to vets. I'm sure like medical practitioner doctors would also be able to do the same. But that's where it comes in. And yes, I think there is a gap, especially in South Africa, where maybe there isn't that bridge between veterinarian and the specialized fields as they are in human medicine, like all these nutrition stuff. But hopefully that is growing, and I'm hoping that it would get better, and hopefully that the information that gets put out there is more accurate. But I've literally had someone where I had to not argue, but convince a client to say that trust me when I say that this food choice is the best option for your pet. Where they looked me dead in the eye and said, no, it's fine. I would rather go with what my dentist said. And and I absolutely took it as the ultimate insult. I was just like, wow, okay, good luck, you know. But yeah, Megan, I think we've actually covered a lot. I loved everything that you said. I love the insight that you gave about heels, and I think the biggest reason for this conversation was I wanted someone with years of knowledge that's in the field, that's working with us every day, that is specialized in this industry to give an open, honest opinion so we can hopefully debunk some of the opinions or myths that people might have around premium brands such as Heels. I think Heels gets unnecessary flack sometimes. Especially if you do things like, and I've done this in the past where I asked in an interview, where people make assumptions, for example, saying by feeding raw meat-based diets, you would treat any skin issue in a dog. And I made the argument to say, if Heels put that statement on their bag, they would undergo such scrutiny that they would shut down. But that statement can be made with other diets, which is not fair. Because again, it's a thing of you need to argue for your conclusion. If you're saying that, where is the science to show where you came at? I don't know how you feel about that statement.
And as I said, like, we are a very open company. I mean, that's the thing is, if you wanting to, we don't hide anything. We don't hide what our ingredient list is. We don't hide our research. It's all there. And if people want it, we are happy to show it to them. I think that's our backbone, and that's like proves where we are, and that what you're getting is definitely, it's science-based. It comes from a great background. It's definitely something that we can back it up. We're not trying to kind of pull the wool over anyone's eyes. We are out in the open for everyone to see, and I think that makes it's a trust thing, I think, too. So that you can trust us because we're going to tell you the truth.
Yeah, it is about trust. You're right. Yeah, trust from the client to the product to the vet and everything. But Megan, is there any plugin that you maybe wanted to put in here at the end to tell people where can they get Heels food, both the science plan and the prescription diets? Is it available worldwide? Are there anything that people need to know about the Heels food?
So our prescription diets, as the name kind of suggests, are for prescription use. So they're there to be treating a disease condition. So we put this in the hands of the vet. So the vet needs to be using this as a treatment protocol. So those ones you're only going to be finding at a vet practice, and you can only buy them from a vet practice once you've got a diagnosis, because certain conditions need certain things. As I spoke about earlier, the nutritional requirements are different. So that's where our prescription diet range kind of fits in. In terms of science plan, that's our really good quality food when your pet's healthy and happy and is not needing any sort of additional treatment. It's a good, and it goes from like kittens to adults to senior pets, and there's a variety of different like products in there depending on if the cat has a hairball, so and so on. So and those ones are available in most obviously vet shops that you can find them. And we at Hills obviously we pride ourselves on quality, so you will find them in reliable, trustworthy shops for them. So that's where we stock. So, but as I said, it's very we accessible. And if there's any vets out there who are also listening, we have a great field team. They respond quickly. Our customer care line responds very quickly. So if anyone out there has questions or concerns, we really do urge them just to either contact the field team or customer care. We'll chat through any concerns with them or any problems that they've had.
That's amazing. Dr. Megan, thank you so much for all the information you dealt with us. And hopefully we can have more of these chats in future, debunking more preconceived theories that people may have, and just have maybe good educational quality information put out there in the world for people to absorb.
Yes, I'd love to. It's like it's a great passion of mine to like get people excited about nutrition, I suppose, and like the benefits behind it.
Yeah, well, that's awesome. We need that. That's what we're looking for. But thank you so much. Hopefully we'll chat again in future. And until then, we'll see you then.
Oh, cheers, Nico.
Right.
Thank you.
Cheers. Bye.